CNN Disease Control and Prevention Centers estimates that coronavirus subvariant JN.1 is currently causing approximately 20 of new COVID-19 infections in this country, and fastest growing strain of virus, also dominant. JN.1 comes from BA.2.86 or Pirola, a subvariant that comes to the attention of the world due to numerous changes in spike proteins. More than 30 scientists were afraid that they had been so mutated. This never happened, but BA.2.86, in some countries, including the United States, grew up very slowly. Some studies claimed that he never really started because he may have lost some of his ability to infectious our cells. BA.2.86 dan 2 generations 1 grandchild so speak JN.1. JN.1 compared the ancestors of Virgo protein. But this seems be enough make a faster and faster virus. The CDC estimates that JN.1's prevalence has increased more than twice in the US between late November and mid-December. It seems to be getting help from Tatil trip and reducing immunity for infectious diseases for the genomic sequence company Helix. When I look at the growth curve, it seems to be rising quite sharply, and it seems to coincide with gratitude break in terms of timing, Shishi Luo said. Variant viewers say they expect the world to be the world's leading coronavirus variant in a few weeks. He is an evolutionary biologist at the University of Guelph.T. Gregory said, "It is very competitive with its current XBB variants, and it seems to be the next global dominant variant group. Ond Ontario follows evolution of virus, which causes virus. JN.1's mutation in his spike is in a position where Gregory says that the virus helps him escape from our immunity. Studies conducted by researchers in Columbia University and China show that our antibodies have twice the ability to neutralize this subvariant. Although this is not a major decrease, it may bring another wave of infection on the horizon. Many countries in Europe, including Denmark, Spain, Belgium, France and the Netherlands, have seen the exponential growth of JN.1 and hospitalization with it. In addition, Australia is growing rapidly in Asia and Canada. Very many Americans chose to give up the latest vaccination tour for COVID-19. And they may have passed last year.did not have significant upgrades. According to CDC, as December 9, only 18 of adults received same low rate the population that took them last year. And latest COVID-19 vaccine. CDC called on doctors work harder to instill their patients and stressed that it was not too late. Benefit from in the season. The CDC also warned that hospitalization increased by 51 for COVID-19 in the last 4 weeks. The good news is that new study of David Ho's laboratory found that existing COVID-19 vaccine, designed to increase the body's ability to fight XBB variant family, offered a good protection against BA.2.86 and JN.1. This finding strongly supports official advice to extensively implement the updated COVID-19